Are you suffering from dilated veins in your legs, heaviness, pain, swelling, night cramps? Then you might be suffering from varicose veins. Varicose veins is a medical condition where there is dilation of veins because of the damage of the valves. If there is damage of the valves, the blood will pool in the leg. Usually this blood has to go from the leg to your heart. Because of the damage of the valves, the blood will get pooled in the lower leg part. This pooling of blood can cause so many symptoms, that is swelling, pain, irritation and heaviness, and sometimes itching as well. The varicose veins goes in multiple stages. Initially you will just see a small veins visible, then slowly the swelling will come, then slowly the skin texture will change, then you will have loss of hairs, and then you will have dryness of the skin, and then itching, and then there is discoloration of the skin as well seen in the varicose veins. So this goes in multiple stages. Usually individual will not realize when the stages increased in the day-to-day basis. So why do we get varicose veins? Varicose veins are commonly seen in both male and female. In males, it is commonly due to long-standing hours, because their profession like security guard, nurses, doctors, they stand for longer duration, which can cause pooling of the blood and cause varicose veins. In females, commonly it is mainly because of the pregnancy, because there is a huge pressure because of the weight of the baby that can cause damage of the valves, that in turn can cause varicose veins. So what are the options now available for varicose veins? Earlier we used to do open surgery, where we used to make a cut in the skin, strip the vein, and that in turn can cause lot of loss of blood and lot of rest is required after the surgery. Nowadays we do not do surgeries. We opt for minimal invasive procedures like laser treatments. In laser treatments we use different kinds of laser, that is called as diode laser, which is 1470 or 1940 nanometer laser. The benefit of using laser is that we do not need to make any cuts in the skin. It's a day care procedure. The patient recovers very faster and the patient can go the same day after the procedure. Today, endovenous laser treatment is the preferred procedure for varicose veins. So how do we do this procedure? Usually endovenous laser therapy is done under local anesthesia or spinal anesthesia based on the preference of the doctors, and that is why the patient can go the same day after the procedure as well. In laser treatment, we make a small access by using a needle, and then we pass a sheath. Through this sheath we pass a laser fiber, and using this laser we try to burn the veins and shrink the veins so that there is no blood pooling happens after the laser treatment. So the entire procedure of lasers for varicose veins can be done in 30 to 45 minutes of the time. So the treatment has become very simpler and very advanced, and patient can get recovered very faster after the laser treatment for varicose veins. Now let me discuss about recovery after the laser treatment. Usually recovery is very quick. As I told, the patient can go the same day after the procedure and they can walk back on the same day after the procedure as well. But having said that, even though there is no wound outside, there might be some swelling from inside. So usually we advise the patients to take rest for 3 to 5 days after the procedure, and you can go back to work after 5 days after the procedure. And usually the dressings would be there for couple of days after the procedure. Following that, you can bath daily without any dressings as such. So the complication of surgeries, not many are there after the laser treatment, but yes, you can expect some mild bruising, some pain, some tenderness can happen where the veins have been treated. Other than that, no major complications are there after the laser treatment for varicose veins if done under proper treatment method. Then comes the cost factor for the laser treatment. Cost usually depends on whether it is a 1 leg or 2 leg, a hospital setup, what type of anesthesia, and also what type of laser fiber is used in the laser varicose vein treatment. I have to tell you that if you use a 1470 nanometer laser, the cost might be a little lesser, but if you want to use a 1940 nanometer laser, which is more advanced, that cost might be slightly costlier compared to the other lasers. So to conclude, laser treatment is a very easy treatment which is much more comfortable to our patients. Early treatment is the key factor. Do not ignore your symptoms. Consult your doctor early to get the best results.